Good afternoon, everyone. Thanks for joining us on the briefing for this Wednesday afternoon. We'll go ahead and get started. We're very pleased to have Dr. Moreno with us to answer your questions on public health and COVID-19. Good afternoon, Dr. Moreno.
Hi, Maya. Good afternoon. So I'm going to again start with just a brief update. So as a reminder, so welcome everyone. So as a reminder, we recently had an increase in COVID-19 cases, and as a result, this, several state health officer orders and guidance documents were revised towards the end of 2021 in response to the increase in cases statewide. But now, given what we know about COVID, about the Omicron variant, as well as the declining positivity rates, case rates, and in many locations, decrease in COVID-19 hospital census, the state health officer announced this week that there will be some amendments to some of those orders and guidance documents. So the first one is the health officer masking order has been amended, and currently, as many of you know, masking is required while in indoor public settings and in high-risk settings. Right now, in high-risk settings, which include public transit, such as riding in airplanes, ships, buses, taxis, face masks are required for everyone. Also in schools, in emergency shelters and cooling centers, healthcare settings, correctional facilities like jails, homeless shelters, and long-term care facilities. Face coverings are required for everyone regardless of vaccination status. And masking is required right now in public indoor settings for all individuals regardless of vaccination status. But this week, the health officer revised the order, returning California to the face covering requirements that were present prior to December 15th of 2021. So effective February 16th, people in California, including Monterey County, will still be required to mask indoors in these high-risk settings, such as hospitals and long-term care facilities, regardless of vaccination status. And people who aren't fully vaccinated will still be required to wear a mask in all other public indoor settings. However, fully vaccinated individuals who will no longer be required to wear a mask in these other public indoor settings. However, there's still a strong recommendation that individuals, even though they're vaccinated, continue to wear face coverings indoors, particularly if there are crowded settings, but it is no longer required for the fully vaccinated individuals. So again, this goes into effect February 16th. The second amendment that I just want to share is the amendment to the state's Beyond the Blueprint for mega events. And the state health officer announced that there is an amendment to this document, which will return the guidance for mega events to the requirements that were in effect prior to December 13th. So currently, there is verification or negative test or vaccination for indoor mega events, which are defined as 500 or more participants in indoor settings, and verification is recommended for outdoor mega events defined as events with 5,000 or more participants. However, again, considering the decline in transmission of COVID-19, effective February 16th in California and in Monterey County, verification of a negative test or vaccination will still be required for indoor mega events, but the mega events indoors will be defined as 1,000 rather than 500 participants. And the verification will be recommended for outdoor events with 10,000 or more participants rather than 5,000 more participants. And finally, visitation requirements at certain healthcare facilities has also been amended. The increase in requirements placed on certain healthcare facilities for visits to patients at places like hospitals and long-term care facilities was temporarily put in place on December 31st. But this week, the state health officer amended those requirements to revert to requirements that were in effect prior to December 31st. So the amended requirements provide a way for all individuals who reside in one of these facilities to receive at least one visitor, even if that person is not vaccinated. So this went into effect yesterday. So unvaccinated individuals may visit a resident of a general acute care hospital, a skilled nursing facility, an intermediate care facility, and adult and senior care residential facilities. If that person has a negative COVID-19 test, I believe it's an antigen test within a day and a PCR within 2 days, and is fully masked. So any individual who want to visit someone at one of these facilities who's residing or being cared for at one of the facilities who has questions about these recent changes should call the healthcare facility directly and ask for the specific requirements for that facility. And that's all I've got for today, Mia.
Thank you very much, Dr. Moreno. We do already have some questions ready for you, so I'll go ahead and get started. Here's your first question. As you have stated, COVID-19 cases in Monterey County tend to lag behind the state and Bay Area by about 2 weeks. Why did you decide to follow the lead of Bay Area health officers on dropping the indoor public mask mandate for vaccinated people despite our higher COVID-19 rates?
So the state health officers pointed out that the transmission of COVID-19 is declining throughout the state. And we see that the case rate is dropping here in Monterey County. The positivity rate is dropping here in Monterey County. And we know that the Omicron variant is, although more contagious, it's causes less serious illness, and fewer people are hospitalized from Omicron than from previous variants. So looking at the trends is really what we look at, not a specific point in time. We look at trends. The trend is for a decline in transmission, decline in morbidity and mortality from COVID-19 at this time. So we are going to continue to follow the state health officer orders with regards to face coverings.
Thank you. Next question. You regularly defer to the CDC for guidance on COVID-19 health measures. The CDC yesterday warned against lifting masking restrictions. Why have you decided to break away from the CDC on masking?
So I and our Bureau of Public Health typically refer to the California Department of Public Health for guidance for reducing the spread of COVID-19. So moving forward, we'll continue to follow California Department of Public Health's guidance with regards to slowing the transmission of COVID-19.
Thank you very much. Those were the only 2 questions that I have. Are there any other questions for Dr. Moreno before we move on to our next topic? Okay, I've got another question for you. Dr. Moreno, why did the health department compare daily cases to the 7-day average of cases per 100,000 to illustrate a decline in cases in its recent press release, rather than using the same metric on both ends?
So public health has been using the case rate here in Monterey County and following the case rate in the region in California for quite some time now. So looking at local trends, we continue to look at the same case rates as we have in the past, and for now we'll continue to look at the same case rates that we've been following and reporting on.
Thank you. Any other questions for Dr. Moreno? Giving it a minute, a couple seconds for typing. If Dr. Moreno, if any other additional questions come in after you are off the call, we'll send them over to you. Hold on. I didn't leave long enough for people to type. How do you plan to provide essential workers and communities of color with additional support to limit widening health disparities as stated in the press release?
Okay, so I can speak on behalf of the Public Health Bureau. I won't speak on behalf of other agencies here in Monterey County. In our Public Health Bureau, we have looked at the those communities that have been disproportionately impacted by COVID-19. Those tend to be our what we call Healthy Places Index Quartile 1 and Quartile 2 communities. And we have, as a Bureau, we have allocated our resources as much as possible to those communities to increase access to services such as vaccines. So fortunately, we've been able to reach many of these communities, and we will continue to provide access as much as possible to these communities to our vaccine clinics, because vaccines are the most effective way of reducing the spread of COVID-19.
Thank you. And then another question, does the county plan to expand access to at-home testing kits?
That one may have to refer to the Emergency Operations Center, who has been recently placing in orders for testing kits.
So I'll forward for the questioner, I'm going to forward that question to somebody else for a response. More questions are coming in. I should say you're about to wrap up and then we'll get all the questions in. The press release that went out today stated, after reaching a high on January 18th of 980 new cases per day, Monterey County's case rate have rapidly declined to a 7-day average of 105 per 100,000 on February 8th and continue to drop. Is it deceptive to compare daily cases to the 7-day average of cases per 100,000 to illustrate a decline in cases?
Again, thank you, Maya. So again, we look at trends. We don't look at specific dates or points in time. So the trends the data that we've been reporting on have shown that the trend is now towards a decline in the case rates, and we'll continue to follow trends and allow those trends to inform our decisions moving forward.
Thank you. Another question, how will the county prepare for future surges of infections?
I can't speak for the rest of the county or for other agencies, just for Public Health Bureau. Public Health Bureau will continue to look at the data that is presented to us. We'll continue to look at any information that is shared from CDC and investigators regarding particular variants, emergence of variants, and we will continue to modify our strategies and transition to whatever lies ahead with this COVID in a manner that allows us to provide the maximum availability of our public health resources to those communities that need it the most.
Thank you. Next question. Why are so few Black residents in Monterey County vaccinated against COVID-19?
Mayor, we do have some estimates of the portion of different populations that have been received at least one vaccine on our county website, and there are discrepancies between, or differences between different groups. There's differences between regions, differences between race, ethnicity, and difference between age groups. So we expect to see some differences. When we see some differences, we do what we can to determine why there are some differences, and if there's something that we can do to improve those differences, we do. So with regards to vaccinations, again, our African American community tends to reside in the Healthy Places Index 1 and Healthy Places Index 2 communities, and so that's why we have in the past, we currently do, and most likely will continue to allocate our public health vaccine clinic resources to those communities where African Americans tend to reside.
And I'm going to ask a follow-up, although I think you might have answered this question. You said that 47% of Black residents are vaccinated. Why so few?
I don't think I said that, Maya. Can you repeat the question?
You said, the question says, you said 47% of Black residents are vaccinated. Why so few?
Yeah, I don't know what the number is, Maya. I'd have to go back and look at our website, but we do know that there are an estimated fewer proportion of African Americans that are vaccinated, and we are working with the best data that we have available. Some of the data does not come in with race or ethnicity when the information is submitted to us, but we report what we do have, and it does appear that there is most likely a lower proportion of African Americans vaccinated here in Monterey County. We don't have answers for why there's differences among the various, for all the differences among different groups, but we do know that when we do see a difference, we do our best to try to make services available to those communities and community members. And in public health, we do that by making our services more available to those communities in their communities to provide better access.
person who's asking the question was saying that the 47% was on one of the charts presented to the Board of Supervisors yesterday. It might, I don't know if you have that chart handy right now, but possibly we could circle back and kind of ferret out what the number question will be after the briefing, if that is okay with the questioner. And that is our I'm not getting a response yet, but we will try to resolve that and we'll respond to everybody on the briefing. That was our last question that we have. Any other questions for Dr. Moreno before we let him go for today? Seeing none, thank you very much, Dr. Moreno, for joining us today and for all your answers. And now we're going to turn to a county program that has been very successful in assisting residents with isolating when they have needed to, when they have had COVID-19. And Krista Hani from our health department is here to tell us more about the isolation stipend program and some of its really marvelous successes.
Thank you, Mia, and everybody. Can you see my slideshow?
Sure can.
Okay, great. So I am here to talk to you about the stipend program, giving you an update. It has been quite successful. It was launched in December 2020. Originally, the plan was as an expansion of the Great Plates program to support the COVID-19 positive individuals needing supports to self-isolate, to encourage that consistent self-isolation through the full isolation period. The program itself consists of a one-time $1,000 cash stipend, and that's usually on a card for adult residents with a COVID-19 positive test result. They cannot be eligible for unemployment insurance benefits or paid sick leave. They have to be early in the stipend process within the isolation process within the first 5 days, and we do check on them throughout that to ensure they're complying with their 10-day self-isolation period or as directed by their medical healthcare provider. And Dr. Moreno talked about how we are focusing with a lot of efforts on those healthy places lowest quartile of that index by census tract and by zip code. And we're doing that as well for the program, and that's in order to positively impact the county's case rate, positivity rate, and the equity metric to reduce those disparities we see between the highest and lowest quartiles of the Healthy Places Index. And those are also areas that have a higher COVID-19 positivity rate than the countywide average. And importantly, we've had partners. The United Way of Monterey County has been a very important partner. They help us by tracking the eligible individuals using the Smart Referral Network software and distributing the stipends. We also have community health centers that are located in those areas of quartiles of the Healthy Places Index zip codes, because they're also going to be testing people, getting positives, and helping to track them and ensuring their eligibility. The program's gone through a few expansions, I guess you could say, or slight modifications, just with the time over time. As I mentioned, we launched with Great Plates, launched with the CARES funds. We continued after that December launch through January through June with ARPA funds. And then also began aligning and working very closely with Department of Social Services and the Home for the Harvest program, checking for eligibility for that program first, and also looking at if people need a safe place to isolate, working with the alternative housing and just coordinating that back in May. And then in December, we saw a dramatic increase in referrals to the program that correlated with the Omicron surge, potentially also some growing awareness of the program and needs out in the community. So just to summarize some of the data here through January 25th, you can see that dramatic increase really started in mid-December. Because of that increase and the amount of stipends and expending the funds for the program, we did stop with the program on January 25th until we could go to the board to get approval for those expenses and for their direction on continuing. We also did see that we had the cities that we had identified had early on with that lowest quartile of the Healthy Places Index, the zip codes, Salinas being the highest, and about 3/4 of the stipends in Salinas were in 93905 and 93906, then followed by Seaside, Soledad, King City, Marina, and some of our other cities, and then another small smattering across the more unincorporated areas of the county. And we are still working, this is preliminary, we're still working on all the data, and for the data that we have, where we have race ethnicity, this was more back in the March through August time. About 75% of the eligible recipients with race ethnicity data were Latinx, which also correlates with early on where we had higher rates of positivity in our Latinx population in the county. And then the stipends were spread quite nicely across all our partners that are participating, and we work really closely together. We have routine virtual meetings to go over the data, looking at the system eligibility, and keeping in close contact on that as we were determining eligibility across all the partners. And we went back to the board yesterday to get approval for the importance, the board supported the importance of the program for supporting those in need, while simultaneously also supporting the benefits of supporting the self-isolation of COVID positive individuals in the county. And they approved the use of the unexpended fiscal year 2021 ARPA funds for the stipend pilot expenses incurred through January 25th of this year. And they directed staff to relaunch the program. We'll have a monthly cap of 100 stipends from today, actually, February 9th, until further direction is provided. And we're very happy with that, very pleased, and are working with our partners to relaunch and also getting the word out in the community. I would like to really close by acknowledging that there's been incredible dedication and hard work by all the partners involved in the program. Deborah McElhaney and her staff with Department of Social Services, the Home for the Harvest program, really amazing teamwork, and especially the eligibility coordinator staff with our community clinic partners and the DSS, as well as the health department, very compassionately helping people and following the program eligibility requirements, and really helping community members in need to safely isolate who had COVID. So if there's any questions.
I do have some questions for you. Thanks very much for that thorough look back at the program. I think people aren't aware how long the program has been in force in some incarnation. So I do have a question for how many people have benefited from the program overall?
So that's the 1,191 that have received the cash stipends or were eligible through January 25th.
Any other questions for Krista about the stipend program before we let her go? Thanks very much for sharing the good news about the continuation of the program and how many people that it has helped.
You're welcome. Thank you. I'll stay on just in case there's any more questions later.
Terrific. Thank you. And then for our last topic, we're going to veer a little bit away from COVID. And perhaps many don't know, but Monterey County has a very robust legislative program that makes sure that our county interests are well known at the state capitol and the national capitol. And this Friday, our supervisors are going to hold a legislative workshop to discuss a variety of things, including state budget requests and the sponsorship of some legislation for a veterans home in Monterey County. And we're very pleased to have Supervisor Wendy Root Askew. She is one of the supervisors who is on our county legislative committee, and she's here to tell us a little bit more about the upcoming workshop. Hello, Supervisor.
Hi, thanks for having me. And thanks, just big thanks to all of our media for keeping the information flowing. We really appreciate your amplification of our messages here.
So that's a good way to start. So people who are mediums or who are observers in the media or in the public, what would be the importance of checking into our workshop on Friday and finding out about this program and the topics that will be coming up?
Yeah, so this Friday at 2 p.m. from 2 o'clock to 4 o'clock, we're going to pack a lot of information into a legislative workshop. The Board of Supervisors is hosting. We'll have all of our state and federal delegation electeds present with us, or a representative from their office, to talk about our priorities as a county, to give our state and federal legislators a chance to share some of their priorities with us, so that we can align our efforts. We'll be on Zoom 2 o'clock to 4 o'clock. Just encourage everyone who's interested in understanding a little bit more about the interplay between the county priorities, state funding opportunities, and federal funding and priority areas. We'll get a chance to hear updates from Congressman Jimmy Panetta, Senator Ana Caballero, Senator John Laird, Assemblymember Mark Stone, Assemblymember Robert Rivas. We'll have a representative from Senator Dianne Feinstein's office, and hopefully someone from Senator Padilla's office as well, to talk with us.
And let me ask you a question. On the list, on the agenda, there are quite a few state budget requests that the county is putting forward, and also actually some very exciting legislation sponsorship. And I was wondering if you could talk a little bit about how those all came together to be presented.
Yeah, so Monterey County, we're a subdivision of the state, so a lot of our resources, we've got some of our own dollars that flow directly, but a lot of our resources do come from state and federal sources. So our ability to work collaboratively with our state and federal partners is really, really critically important. The legislative program is sort of the space where we do a lot of that engagement. So Supervisor Luis Alejo and I both sit on the county legislative committee this year. And I'll share a little bit about some of the big issues that we're pushing forward right now. One of them is a sponsor legislation, which we don't do very often, but when a specific need presents itself, the issue that we're asking the state to really champion is to the creation of a Monterey County Veterans Home. We would be doing that in partnership with CalVet, the VA. We know that the need is great across the state, and we know that Monterey County is a special place for veterans, and a lot of folks would benefit from having additional senior housing with the Monterey County Veterans Home. So we're going to be talking to we'll have a presentation from Jack Murphy, our Military and Veterans Affairs Management Analyst, on Friday, going into more detail about that request. And then we have got about 5 state budget requests that we're putting forward. And I'll just list them out, but we will have additional talking points, one-pagers, and some opportunity for discussion on Friday. The first of those is a $312 million request for water storage infrastructure and maintenance projects. $300 million for that, and then a $12 million request for the San Lucas Clean Drinking Water program. We'll have presentations from our Water Resource Agency General Manager and our Public Works and Facilities and Parks Director. The second request that we're putting forward for state budget request is some dam and safety and infrastructure funding. We'll again have Water Resource Agency provide a little bit more detail about that particular request. We're putting in a $15 million request for funding to do some renovation to the historic old Monterey County Jail. That's the facility that sits on West Alisal, right in front of the Government Center. We'll have a presentation from Randy Ishii, our Director of Public Works, Facilities and Parks, about that request. We have a really exciting request for $40 million to rehabilitate a mental health facility in Monterey County so that we can better meet the needs of our behavioral health clients who require facility treatment, inpatient or outpatient. We'll receive a presentation from Elsa Jimenez, our Director of Health, on that. And then a $10 million request for a project that I'm really excited about, which would be the need for a new health clinic serving Marina. Elsa Jimenez will also be presenting on that. And for anyone who's seen been inside our Marina Health Clinic, you'll know exactly why we have a need for a new health clinic serving our residents out here. We'll also have opportunities for the Board of Supervisors to share their brief opportunities to share their highest priorities with our state legislators. We'll have all of this packed into just a very fast-paced 2-hour workshop. So anyone who wants to tune in will be live streaming on Facebook as well as YouTube. Public comment will be only for items that are listed on the agenda towards the end of the presentations. But it would be a great opportunity to just sort of hear in a snapshot about what the priorities that our legislators have and how they're using their voices to represent Monterey County's interests in Sacramento and DC.
Thank you very much for that really thorough rundown. And there is a packet of information for those who are interested. I've got a series of fact sheets that are a part of this agenda, and I'm sending it out to our press corps so you can take a look at these projects that they'll be talking about. Before you go, Supervisor Askew, I do want to ask you a little bit about the Ledge Committee, because it's more than just this workshop. You didn't spend a year preparing for a workshop. And one of the things that is a very visible outcome is letters. You send out letters on a variety of topics. It seems almost every week about issues that are important, but one letter in particular comes to mind. About a year ago at this time, a letter went out asking about why Monterey County isn't getting enough vaccines. And if anyone ever wondered what happens to those letters, do they really make a difference? I think this is a great example of why the Ledge Committee does do those letters.
Yeah, I'll just say, the county has made a fairly significant and intentional investment in a legislative program. We have county staff who are dedicated to supporting our legislative advocacy efforts. We also have a contract with an outside lobbying firm, both in Sacramento and another lobbying firm in DC, that helps us get our messages in front of the decision makers who need to know what our needs are. And I think that if we've ever seen the significance of why we have that legislative investment and that advocacy investment, it has been this past year when we did have very critical and urgent needs specific to Monterey County, and we were able to utilize those lobbying firms to get our messages exactly to where they needed to be with the context and the urgency that allowed for things to move and for the ground to shift and things to shake loose to meet the needs of Monterey County. And I'll say all of those letters that we send out, we have a legislative priority platform. So it sort of outlines our big picture goals as a county, but then we're constantly monitoring state legislation. We're constantly monitoring federal legislation. And there are times when the county can go on record with support or opposition. We're usually doing that in partnership with other counties or the County Alliance of Counties or the Alliance of National Counties. And it's not just the letter that we're sending, but it's who we're sending it to, how we're getting it in front of them, and how we're using our voice to cause for state and federal action that's going to ultimately bring additional resources into Monterey County. And I think we've got a great team of state and federal legislators who are listening to us, who are carefully paying attention to the needs of Monterey County and really going out of their way to find ways to prioritize what our needs are right here, what the residents of Monterey County need, and securing those federal and state resources on our behalf.
Thank you very much for sharing more about that and and behind the story behind the letters and what happens afterwards.
Yeah, and if I can, I don't see any questions popping into the chat, but I just want a couple other things from the earlier in the message. I'm just really thrilled with the work that our health department and our Mohawk EMS agency is doing to secure additional testing supplies to keep rapid testing available in Monterey County. The Board of Supervisors a few weeks back allocated spending up to an additional $1 million to purchase testing supplies to supplement what the state was providing us. And I think that we the commitment that we have in Monterey County to keep testing available is strong, and is evidenced by that willingness to commit resources. And then for anyone who has sort of questions about how those testing and other supplies are being distributed out into the community, we had a great presentation at our board meeting yesterday about the Mohawk, which is the system that we're using to distribute testing, masks, and hand sanitizer, as well as other medical supplies out into communities where the needs are greatest. So we really are making a significant effort to push all of this, these PPE supplies and testing supplies back out into the community to help people stay safe. And then we do have coming forward later next month is an update on the VITA program, which has been really incredibly successful, helping to host pop-up testing events and help let people know about programs like what Krista Hani presented, the isolation program, as well as other resources that we've really, I think, gone above and beyond in Monterey County to provide to some of our residents who otherwise wouldn't have as many options available to them to isolate and protect their family.
Thank you. Thank you for those comments. And are there any questions for Supervisor Askew about the legislative committee or anything else? Seeing none, thanks very much for joining us, Supervisor. And Krista, I see you're still on the call. Our next media briefing will be next week, and we'll see you then.